Hello everyone, today we are going to discuss regarding the liver histology. This is one of the more and more interesting topic. So before entering in detail with the liver histology, we will just have a recap regarding the blood supply of liver. So in case of arterial supply, already in our previous video we had read that it has two different arterial supply. One is from the hepatic artery and another one is from the portal vein. So here this hepatic artery arises from the celiac trunk, which is a branch of abdominal aorta, and this is our hepatic artery, which mainly contributes only 20% of blood supply to liver, and this one is highly oxygenated. And from spleen we will be having one vein, that is splenic vein, and here we will be having superior mesenteric vein. Both get joined behind the head of pancreas and forms the portal vein here, and which runs along with the hepatic artery. And here the most interesting thing I have to say that it carries about 80% of blood supply to the liver. So as our portal vein receives blood from spleen, GIT and pancreas, we should know regarding the constituents of the portal vein blood also here. This portal vein blood is not much oxygenated, and the blood from the spleen will be having the debris of RBCs and macrophages and everything. That will also be received in the portal vein. And in case of pancreas, we will be having different enzymes and hormones. For example, insulin have its own specific action over the liver, and glucagon has own specific action over in glucose storing metabolism and everything. And in case of GIT, this portal vein will get all the absorbed nutrients, even sometimes toxins will get into the portal blood, and all this portal blood enters into the liver. And in case of liver, this blood coming from the portal vein gets purified. That is the major mechanism of liver, that is none other than detoxification. Our gallbladder will be having the cystic duct, which joins with the hepatic duct arising from the liver and forms the common bile duct, which enters into the GIT. We all know regarding this. So here all these three structures, that is hepatic artery, portal vein and bile duct, forms the portal triad, and it enters in the liver in the inferior surface called as porta hepatis. So another one important structure we should know in the portal triad is the lymphatics present along with the artery, vein and the bile duct. So now we had seen regarding the arterial supply. So now let us discuss how the blood get mixed up and how they are drained into the venous drainage. So as I had already mentioned, we will be having the hepatic artery, which runs along with the portal vein together, and both of them enters into a structure called sinusoids, where their blood gets mixed up. So here in case of our hepatic artery, we will be having more oxygenated blood, and in case of our portal vein, we have lot of things like enzymes, we will be having the debris, we will be having the nutrients, toxins and everything. All the things gets mixed up in the sinusoids, and these sinusoids drain into hepatic vein. And finally, these hepatic veins drain into inferior vena cava. So inside our liver, we will be having lobules, which were hexagonal in shape. So this is our hexagonal lobule, and in the corner of every lobule we will be having our portal system. So first is hepatic artery, then comes our portal vein, then comes our bile duct. So along with this we will be having the lymphatics also, don't forget. So this is how the portal system is situated in all the corners of the hexagonal lobule, and here we can find a central vein. So now let's see where these sinusoids are present in the liver parenchyma. So this is where the arterial supply we can see, and here is the venous drainage. So the connecting part, as we had already seen, is the sinusoids here. So this is our arterial end and this is our venous end. So here our central vein gets drained into the hepatic vein, which drains into the IVC, and here comes our sinusoids, where here our portal vein blood and hepatic vein blood gets mixed up, and they will enter into the central vein. And we all know that the blood flow from the arterial end towards the venous end. This is called as centripetal blood flow. So now we have discussed regarding how blood is flowing inside the sinusoids. So now let's see where the hepatocytes are located and how bile is getting secreted from the hepatocytes. So this is where we can see the plate of hepatocytes situated near the walls of the sinusoids. Everywhere it will be located like this. So here we can see one space between the hepatocytes and sinusoids. This one is called as space of Dizzy. You might have heard regarding this. So inside the space of Dizzy, we will be having one special cell that is none other than Ito cells. And this Ito cells helps in the storage of fat and vitamin A. So now let's see how bile is secreted. Bile is secreted from all the hepatocytes and it travels opposite to the, it travels away from the central vein and it gets drained into the bile duct situated here. So this is how the things are happening, like the blood flow will be towards the central vein, that is centripetal blood flow, and the bile will be traveling in the opposite manner, that is centrifugal blood flow. So now let's see the cross section of biliary canaliculi. So here blood enters this way towards the central vein, and here these sinusoids are made up of endothelial cells, and here we can find large fenestrations, and here the basal lamina is also very discontinuous, and here we will be having the macrophages which are called as Kupffer cells that would be present here along the sinusoids. And here what will happen once the blood is entering, the plasma will get leak into these large fenestrations and gets contact with the hepatocytes. If the blood is having more amount of enzymes like glucagon from the pancreas, it may stimulate the hepatocyte to promote the glucose metabolism, and based upon the signal it will promote the action. If there is more toxin in the portal vein from the GIT, then the hepatocytes will undergo detoxification like that, and again the plasma will get back into the sinusoids and it flow into the hepatic vein. And in case of bile secretion, as I had already mentioned, the bile would be secreted from the hepatocytes and the bile travels in a centrifugal manner, like out away from the central vein, and it gets drained into the bile duct. So that is some more interesting thing, that if there is any if there is some plasma situated in the space of Dizzy, that plasma will get drained into the lymphatics, and this is how the blood flow and the bile secretion are maintained inside the liver. So based upon the clinical significance, the liver architecture can be approached in three different ways. One is classic lobule, which we had discussed now. Then in the aspect of portal lobule. Then in the aspect of hepatic acinus, where hepatic acinus is called as the functional unit of liver. So now let us discuss regarding the portal lobule and its significance. So this forms a portal lobule. Now regarding hepatic acinus. So now regarding the hepatic acinus, which forms the functional unit of liver, and this acinus is divided into three zones based upon the blood supply. So here there are three zones: zone 1, zone 2 and zone 3. So you just have a guess, like the hepatocytes in which zone will be receiving more blood. Obviously it will be in the zone 1, like this is zone 1. So here we will be having the hepatic artery and portal vein. So the hepatocytes present here will be receiving more blood, and here it will be moderate, and here it will be very poor blood supply. So based on the blood supply, it is divided into zone 1, zone 2 and zone 3. This unit forms the hepatic acinus. So this diamond shaped is called as hepatic acinus. So now let's see regarding the clinical significance of this hepatic acinus. So in case of ischemia, you can have a guess which zone would be easily affected, which zone of hepatocytes would be easily affected. Yes, it is none other than hepatocytes in the zone 3, because already there will be poor perfusion. So whenever if there is a less amount of blood also, that will be utilized by the hepatocytes which were present in zone 1. So in case of ischemia, we can expect zone 3 cells to be affected. So for example, in case if a patient had took the organophosphorus poisonings or toxins, which zone would be easily affected? So it is very clear that the zone 1 will be easily affected, because it will receive all the toxins directly from the blood vessels. So it is zone 1. So this is the clinical significance of the hepatic acinus. So you should know another one important thing, that the liver is covered by Gleason's capsule, which can be asked frequently in MCQ. So this is all regarding the histology of liver. So if you have any doubts, you can comment below, and if you have any suggestions for the topics to be discussed, that can also be commented below. Thank you so much. Happy learning.